So before we break for the meet and greet with our speakers, I wanted to share a little bit about our organization, Health Freedom Ohio, and our purpose for existing. Recently, I read a report about the state of health in our youth today. 54% of our children now suffer from one or more chronic diseases. We are witnessing explosions in neurodevelopmental disorders, severe allergies, autoimmune conditions, and cancer. The children's hospitals are in a constant state of expansion. If you drive by them, they are always building. Headlines recently out of Eugene, Oregon read, "Eugene schools face behavioral crises, board told." The teachers are reporting children biting, kicking, hitting, screaming, and urinating in the classroom. This is not normal. And it isn't just happening in Oregon. This is a systemic issue, and it's happening at all of our schools across the nation. In 2017 alone, over 7 million children were taking psychiatric drugs, many of them under the age of 5. It is estimated that 13 to 25% of the student body now use special education resources. This is not sustainable. It is not just the children. It's reported that 7 out of 10 adults are taking pharmaceutical drugs. According to IMS, Institute for Healthcare Informatics, we spend an estimated $200 billion per year on the unnecessary and improper use of these drugs. Researchers from Johns Hopkins recently reported that medical errors are the 3rd leading cause of death in the United States. We are living in a time when a child in the United States is more likely to die before their first birthday than infants in other wealthy countries. Women are more likely to die giving birth in the United States than in other wealthy countries. We are failing at health. We are failing our children. The government and the medical consensus tell us that they don't know why our children are in a poor state of health. Perhaps it is not that they do not know, but that they are not allowed to say. The pharmaceutical industry continues to control every area of healthcare and has a very tight grip on our political and scientific processes. They are controlling those who write guidelines that shape health policy. They are writing legislation that is designed to strip us of our liberty to decline their products. The jury is in. The failing health of our children is proof enough that a healthcare system founded only in pharmaceutical drugs is destroying our nation and our future. We do not have drug deficiency disorders. The parents of healthy children, who are now a minority, they know this. The parents who are recovering their children from autism, Scott, you know this. The parents who are recovering their children from seizure disorders, they know this. And the people who are recovering themselves from cancer and other chronic conditions, they know this too. So I say, the question isn't how people die, but how they want to live. Do you want a life dependent on drugs recommended by an industry that profits off you remaining sick? Or do you want to find the power and wisdom of how to truly heal? The solution to all of this is us. Each one of us has a voice. It is up to us to decide how to use it. Each one of us votes with our dollars. It is up to us to decide how we spend them. However, we are only able to appreciate a life enriched by our right to maintain health freedom when we are fully aware of our choices and free to access them. That is the purpose, the intention, and the mission of Health Freedom Ohio, to raise awareness about alternative pathways to health and wellness. Our goal is to bring together those who seek an alternative to allopathic, pharmaceutical-based healthcare, and those who are practicing these modalities. Our goal is to unite our voices as consumers and providers to stand up to legislation that limits our freedom to choose. while pushing for greater transparency and greater access to these choices. It has been both an honor and a privilege to share this time with you all tonight and to be able to share this message. My hope is that we can all find our voices. My hope is that we see an end to medical kidnapping, to forced consumption of pharmaceutical product as a condition of employment, or for a child to gain access to their right to an education. My hope is that we stand together to put an end to medical tyranny. Thank you all very much, and we will now have our meet and greet with our speakers.